Okay, so when these three component actually happen, right? Then it's time to call 995 to call the ambulance, okay? You need to rush the hospital immediately for treatment lah. Okay, next. So, what is the sign and symptoms of stroke? There are actually 5 components of it. It is very important to understand that every patient is affected by stroke differently. So everyone is different. Not everybody have the same symptoms because it depends on the part of the brain that are having the stroke lah. So the sign and symptoms of a stroke depends on the area as what I mentioned lah. So firstly, you may experience weakness in one or both sides of the body. The weakness actually varies in severity lah. And then there's a weakness of the face muscle may result in face drooping, which is the first part of the acronym, right? Face drooping or drooling or speech difficulties. So you may also have experienced difficulty in standing, walking, or performing delicate tasks. The second one will be sensation. You might experience numbness. You may experience reduced or loss of sensation over one side or specific parts of your body. You may also experience abnormal extra feeling over one side of your body, such as tingling sensation or electric sensation lah. Okay, next, come to the communication part. So, as what I mentioned just now, slurring of the speech is one of the symptoms, right? So we call it as a dysarterial, slurring of speech. You may experience difficulty in articulating words. This may cause your speech to be unclear, slow, or soft. So just remember, it's a sudden thing, like it's an acute thing. It's not like usually you talk, you already talk unclear. It's not stroke lah, but suddenly you cannot really talk well, then we might worry that it's a stroke lah. So another one is language impairment. We call it as dysphasia. So you may experience inability to understand or express the words you want to say, or the sentence, the phrases you want to express, you're feeling difficulties in both verbal and written form. Just for example, like suddenly I want to tell you something, but in my brain I'm thinking I want to tell something, but actually when I want to say it out, it's very difficult for me to express. I can't express what I want. This is a sudden thing also. If let's say you experience this kind of symptoms, it's a sign of stroke. Okay, then we go to the vision. You may experience double vision or vision in one side of the area got problem lah. So also remember, if you already have follow-up with SNEC, already have vision problem, you already have cataract, cannot see properly, it's not stroke lah. So you just continue with the follow-up. But this are pertaining to someone that actually can see clearly, see properly, suddenly visual in, we will think that, oh, maybe this is stroke. Okay, so stroke also will affect the way you swallow. Okay, difficulty in swallowing, we call it as dysphagia. You may have trouble with drinking and eating. You will get choked like coughing or choking when you're trying to swallow the food. And this actually will increase the risk of lung infection. Why? Because when you choke on the food tends to go to your lungs and cause the infection and have more contraindication lah. Okay, so next, okay, I will be passing to my partners to talk more about the risk factors. There you go, Minjia.
Okay, thank you, Apple. Can everybody hear me? Okay, so now I will talk to you about the stroke risk factor. Okay, so let me tell you some facts first. So after having stroke or transient ischemic stroke, which is known as the TIA, the mini stroke, your risk of having another stroke or TIA is actually become higher. So about 4 people in 10, right, who have stroke will suffer another stroke within the next 10 years. So therefore, it's very important that you have to modify your lifestyle, take a medication, and lead with a healthier lifestyle. Okay, because if there's a poor control of the stroke factors, right, it will put you in a higher risk and may increase your chance of having another stroke. So, okay, stroke are actually divided into two components, which is the uncontrollable and the controllable. So let us discuss what kind of risk factor that we cannot control. So actually, we cannot control our age, huh? Okay. So women and men actually both have this and at different age, all age, stroke can actually affect people at all age. So your risk will increase after you reach 55. Actually, double up every time you grow older. Okay, and men actually have a higher risk of stroke compared to women, but doesn't mean that women don't have risk of having stroke. You do have a risk of having stroke, but your risk only will occur after the menopause. So the next one is hereditary factors, like you have some genetic causes, like all this will actually increase your risk for stroke, and this is also uncontrollable. Next, stroke in the next 10 years, or this having stroke. Okay, so now, so what are the risk factors that actually we can control? So actually we can control like our chronic disease, like high blood pressure, high cholesterol, diabetic. Okay, then you can click off your like smoking habits and your alcohol habits. Further explain to you, okay, why high blood pressure is something that we can control. Okay, actually increase your risk of having stroke 4 times higher. Okay, then as we know, actually high blood pressure, if you don't control, is actually one of the very, very high risk factor. So yeah, so high cholesterol actually increase your heart attack episodes 2 times. Then actually when you have heart attack, then this will increase your risk for having stroke. So diabetic. So why diabetic will increase the risk for having stroke? Because if you don't control your diabetic for over a period of a long time, it actually damage the blood vessels, and after that, and your nerve. So having diabetic, it will increase your risk for stroke for 1.5 times. Okay, so smoking will actually increase your risk also 1.5 to 2.5, because it's also it also will actually damage your veins and your blood vessels if you're smoking for long term. But if you have intention to quit smoking, it does help you to reduce down the risk. If you're smoking, then your risk will be a bit lower. Okay, talking about this irregular heartbeats, like we know that stroke and heart attack actually they are hand in hand. So if you don't have a good heart and your heartbeat is irregular, therefore it definitely will increase your risk of having a stroke. Because if you have irregular heartbeats, then it will actually increase the risk of forming clots in your heart. Then when there's a clot in your heart, then it will travel all the way to your heart, to your brain, then causing a blockage, like what Apple has discussed just now. Okay, and after that, like being inactive, not moving around, not doing exercising, then health promotion will actually encourage us to exercise at least 150 minutes per week. Then like obesity, obesity is also one of the worldwide health issues. So that's why government telling us to keeping our BMI like equal or less than 23. Then excessive of this alcohol consumption. And if you have uncontrolled blood pressure, uncontrolled high cholesterol and diabetic, it definitely will increase. Okay, because like just now I said, high blood pressure is 4 times, high cholesterol is 2 times. Then after that, having diabetes is 1.5 times. So actually it will all cause a lot of issues if it's not controlled. Okay, so next up. So how does stroke affect us? Okay, so it does affect us in various areas. Okay, so not only physical, it also affect us in emotional. So like I shared, okay, depending on the is on the left side, on the right side. So everybody will have different experience when they have a stroke episodes. Depending which part of the front, the back, the left or the right. So their experience of the consequences of the stroke that I'm going to discuss will be different also. So like what she shared, you will have one side weakness, and therefore you are unable to have balance and you cannot coordinate your movement properly. It will affect your ability and also your activities, daily living, like going to toilet, transferring, eating, walking, all will be affected. Then you may experience or having this difficulty in swallowing. And when you have food, you definitely a special consistent type of food, like and food, or even worse, if you cannot swallow, you have to have a tube in your nose. So they will consume the milk through the tube. So all these dietary actually not enough for you. Definitely you need supplements like protein, energy, and calories. If not, you will have muscle wasting. So it will actually affect your nutrition. You will feel that you are losing weight. Then after you're having stroke, because it's affecting your brain, so actually your cognitive will be affected. Like your memory will be affected. Your attention span will be affected. You will feel that you can't like do a lot of thinking and reasoning. You're like a lot of that you cannot articulate properly. So it actually affect your ability to perform some decision making and making some doing some tasks like crossing the road. Okay, then it will affect this continence, which is your bowel movement and your weakness of the body. So the muscle in the bladder is under the control. Then after that, you need to before you reach the toilet, you actually realize you already saw yourself. So this will actually affect you when you're outside. Okay, next up will be your like emotional. Then you'll get tired easily, the behavioral change, and you realize that maybe you or your family members realize that after stroke, your personality changed because after stroke, you actually damaged part of your brain. Okay, there's no nutrients and blood supply to the brain. So it will actually affect you to make judgment, affect your mood. You realize you get angry easily, or you will become very quiet, or you just don't want to talk, or you feel very excited. So all this will actually affect behavior. So because of your this restrictions to your ability to movement, so definitely will actually affect your sexual activities. You cannot have physical intimacy. So why do I bring up this? Because like I say, stroke actually affect all ages. Okay. Then because of the restriction of your movement, you eat slower than other people, you move slower, and you're afraid of fall. Then you will restrict your ability to go out to socialize with friends, moving out with your family members. So you will actually affect you to be social isolated. Okay, so what are the complications after stroke? Okay, not to scare you, but when you stroke, you do have some complications. So this is likely for those who are bed-bound or like chair-bound, like taking a wheelchair. Okay, so we will talk about some symptoms, okay, and problems. So it's better for us to manage, detect all this problem before it gets worse. So early detection, early treatment will complicate the things. So the first thing I want to talk about is the contraction, whereby your arms and your hands will be not able to move due to the permanent shortening of the muscle and the joint, causing your hands and legs at a fixed position, unable to move. Then you look like a robot, then you cannot move. Okay, you move like a whole body. Okay, then you will have possible like swallowing issues, impairment, right? Causing you to have some lung infections. Okay, because you can't swallow, and the water or the food particles can actually go to your windpipe without you noticing. That after that, causing some infection, which is very common. That infection is very common in stroke. Then next up is like I said, it affect your continence, right? Your urine in your urine and poo, right? You cannot control well. Then high chance that you'll be on diapers. And long term, you're in diapers, right? Then you will be in a damp and moist condition. Then your skin will break down. Then actually, it will cause you to have a risk of having urinary tract infections. Okay. Then like you are sitting on the bed for long because you can't be like normal because for us, right, when you feel aching at the body, then you move, then we feel like tired, we will walk out, right? But for stroke patients, sometimes they are unable to move, so most of the time they are sitting down and lying down. So if there's a constant pressure over certain parts of the body, especially like your bony area, your this shoulder blade, your sacral, right, where you are sitting down, the bone, that's your heel bone, all these, right, if you don't move much, then your skin actually will become redness. And if you continuously don't have any blood circulation there, then it will become a wound. Then you will cause a pressure sore, and the skin will break down. Okay. Then next will be deep vein thrombosis, whereby because you know that the blood circulations will be not so effective like before. Then after that, your body tends to have this formation of blood clot in the vein, then causing the poor circulation to the leg. So you do have some deep vein muscle because like your body, your brain is your brain is injured So after that, your muscle, all this will cause you some give you some electric signal to tell you, oh, this pain because you didn't move for so long. Okay. The next will be a seizure because so we do have some abnormal electric activity in your brain. Then sometimes when it's worse, all this, it will cause you to have seizure. Okay. Then after that, this shoulder section, whereby you have partial dislocation of your this joint. Okay, because there's this lack of support of the arm due to the weakness of the hand because you don't move much. So there's no support because you don't move, then everything will shrink. There will have contraction. Then after that, they don't connect well. Then there will be some dislocation. Okay, next. So after hearing so much of the complications and how stroke affect you, definitely I want to share with you what are some of the prevention to prevent all these things that I share with you that can happen to you. So definitely when you have stroke, you cannot avoid having medication. Like high blood pressure, high cholesterol, and high diabetic. The doctor will say, okay, you just improve your lifestyle, cut this, cut that, don't eat this, don't eat that. But for stroke, definitely you have to take medications. Okay, then have to do some lifestyle modification, which I will discuss. And regular health screening is actually very, very important. Okay, so doing all this prevention, actually reduce that things that can happen to you. So, okay, we will discuss about medication. Okay, so you may be familiar, okay, if your family, your friends, relatives around you may be telling you what medication they have. So they break down into these three big topics, which is very common. Actually, there's more medication, but I just share the basic one, which is like antiplatelets, anticoagulants, cholesterol-lowering medication. So antiplatelet medicine like aspirin, it actually makes your blood less sticky to form clots to travel around in your body. Okay, so it's essential to take antiplatelets, okay, like warfarin. It helps to prevent the formation of new blood clots and actually keep the existing blood clot from getting bigger. Okay, then like cholesterol lowering medication, like actually apple shared, actually you having stroke affect your heart, affect a lot of your heart, your blood vessels, all this. So if the doctor prescribe you to have this cholesterol lowering medication like somatostatin, atorvastatin. Okay, this is to help to reduce your cholesterol level and help to reduce the risk of stroke and heart issues, heart disease that you probably will have. Okay, Next, okay, we talked about lifestyle. Okay, so you have to adapt and try to change. I don't expect you to change like 100% tomorrow. You change, slowly change, slowly give yourself goals to change. Or if you can quit smoking, example, you're smoking 20 sticks, cut down to like 10, 5, slowly, gradually cut down. And if it can possible, then just quit smoking. Then limit your least alcohol consumption. Don't binge drinking. I mean, people will say, oh, actually, they advise us to drink alcohol. What is good? But to me, is limit yourself, like 1 or 10, or like half a cup if it's hard liquor. Okay, limit. I never say stop. Say limit. So you have to limit your alcohol consumption and don't drink in a amount. Okay, then have a healthy and well balanced source of carbohydrate, which is your rice, your whole grain things, half water, your protein, like you take a fish or meat. And actually we talk about half eating like vegetables and fruits. So this is what we call the well-balanced diet. You have all kinds of food mixing together during your breakfast, lunch, and dinner. Okay, then eating healthily, like eating like more of the steamed food, stir fry, okay, boiled food. Once in a while, you still can eat like fried food, but you can cut down. Exercise regularly, that I did share with you to make a hard work, let yourself sweat, walking around, like watching the TV. There's a TV program showing you how to exercise, because now because of COVID, you cannot go out to exercise at the senior activity center. You can exercise at home or walk in a park. Okay, maintain your healthy body weight. Like I said, keep your BMI less or more than 23, because you see, every time you go and visit the doctor in the polyclinic, they will definitely check your weight and height to make sure that your BMI is within range. Okay, then take a medication as prescribed by the doctor. Like I said, don't skip your medication. Don't say, oh, my blood pressure is good, don't need to take. Oh, my cholesterol is better, don't need to take. Okay, unless the doctor advises you to stop taking, then you don't take. If not, he will very, very strongly encourage you to take, okay, your medication regularly. Attend your medical appointment with your doctor as per schedule, so that the doctor will know what is going on, if there's any signs and symptoms, or if your lifestyle is improved, if they cut down medication for you. Okay. Okay. Next up will be this health screening. Okay. So what is health screening? Health screening is very important to everybody. Okay, including me. Okay. So this health screening actually includes some like simple tests, like examination, physical examination. The doctor will ask questions, do body checkup. Okay, ask you to do simple like blood test, urine test, X-ray, face stool test. Okay, so actually we really encourage people to detect their condition early. So to do early detection, then after that prevention better than cure. So when you do health screening, you actually do some prevention, then better than cure. Okay, so you'll be wondering why I need to go for health screening. Okay, health screening is actually quite essential. It helps you to find out like the particular condition you have, even though you are well. Okay, if you are younger, you definitely don't have any kind of symptoms. You don't notice it. So you go for regular health screening, actually let you pick up like certain abnormalities in your body that we can do like again early detection. Okay, so yeah, so when you have early detection, you have earlier treatment, then you prevent yourself to get complications and prevent to have complications. Okay, then what do I do after my health screening? So right, if your results normal, you continue to go to regular. It can be a 1 yearly or it can be a 2 yearly. Okay.
Sorry, Ming Xiao, can you please speak a bit louder?
Normal, the doctor will... Hello?
I cannot hear you. Very soft, your voice like your voice comes swallowing in. You cannot hear
now
clearly.
You can hear me?
Yeah, yes. Thank you.
Okay, sorry. Yeah, so if your blood result is abnormal, so the doctor will actually arrange to let you go and see him maybe 1 to 2 weeks. Then after that, have a very close follow-up, like maybe 1 month, 3 months, 6 months, if your condition is better. So early treatment let your condition better control, then also prevent from further complications. Okay. So yeah, This is my reference. Actually, it's the end of come to the end of our presentation. Okay, so actually we are open to have some Q&A. So any questions from the ground? You can open
yes.
up your mic and ask questions.
Yes, please. Before the question answer, there are 2 slides before all the links. Can you please project that again, please? The links. All the
Okay, all the
website.
link, right? All the link, right? I get it from Health Hub. You just go to Health Hub, go to Stroke Hub, then you can go to all the information that I have. You can short, no problem.
Thank you. Thank you.
Okay, anyone got any question to ask us? You all can actually unmute and then we can discuss. If let's say you all don't have question, then we have question for you all.
Excuse me, are there any exercise that can help to prevent a stroke?
Okay. Exercises actually don't have specific exercise that can really just for stroke lah. But basically, general exercise, stretching exercise, like those balancing exercise, stretching, ROM, brisk walking, swimming, all actually is a very healthy thing to do lah. So it actually can prevent a lot of illness and sickness lah. So we don't have anything like, oh, this exercise specifically for stroke. Actually, it's not like that lah. So generally, be active in your daily living, and every day just move and do some exercises can help lah. Yeah. So if let's say you think that, oh, you are actually very tired and then you cannot really walk, cannot do brisk walking, or cannot do any high intensity exercises, actually simple exercises at home is okay also. Yeah. So those morning program from the TV, right, actually got show you how to exercise at home. Just very, very simple. You just follow and do together. Every day do according to your own preference lah. Okay, so you don't force yourself. If let's say you feel really, really unwell, then you don't force yourself. If let's say you are okay, then you can continue doing it lah. Keep yourself healthy every day. Yeah, I hope I answered your question.
Yeah, thank you.
Are there any pre-signs or conditions that before the stroke? How would you notice that this so-called patient in a way that you say, oh, he may have a sign of stroke? How do you see it?
Sorry, can you repeat your question?
What are the pre-signs or conditions you can see in a so-called what we call patient that you can notice this patient or this man is in trouble? Can we have a quick action?
Okay, so as what I mentioned just now, okay, we all usually teach you acronym, fast acronym. F-A-S-T. So just remember, S stands for face. Okay, just look at your face when you smile. Usually, right, we will be like balanced lah. So sometimes the sign and symptom is like one side of the face droop already. Then it's sign of stroke. Or A, arm weakness. Suddenly, one side of your arm becomes very weak. You cannot really hold things, or you cannot even raise up your hand. Okay, and then you have like difficulty in speaking or anything. So this kind of sign and symptoms, if happens, right, then you need to think, oh, is it I having a stroke? Suddenly I cannot do this kind of thing. My face suddenly drooping. Then I need to call ambulance. Straight away go to the hospital for medical advice lah. Okay.
Okay.
Sorry, I should prepare some questions for you to answer, but now I cannot share the screen. Okay, why not I just ask, okay, how many types of stroke are there? Anyone can know? You can open up your mic and share with us, or you can type in a group chat to tell us.
Helen, I think you're muted.
Three. I think it's three. I'm not wrong.
Three. Very good. So do you know what are the three?
Well, I know the last one is that. I know the last one is that temporary one, right?
Yes, correct. That's the temporary one. So
the other two, what we call it? Anything?
Ischemic? Ischemic stroke. Very good. Good try. And a hemorrhagic stroke.
Yeah, one is hemorrhagic. Okay. Yeah, one is hemorrhagic.
Yeah.
Second one is
just give them a simple name. Yeah, so we call them the blocked artery lah, where just now Apple show you all, right, the garden. Okay, whereby the garden have some cut of supply where the water can go to the plant. So that's a blocked one lah. So that's ischemic. Then the hemorrhagic is when a pipe is burst. It's called a burst artery. Yeah, so when the artery is burst, then it stops supplying blood to our brain lah. Okay. Then yeah, the third one will be the mini stroke lah, the TIA. Very good, good job. Thank you, Helen. For sharing. Actually, we prepared a slide, but I cannot share the thing for you. Yeah. Okay. So just now when we answering Mr. who let me see, Mr. Gideon, right? Mr. Gideon, right? He's asking. So how to recognize the initial stroke lah. So it's using the fast, the face drooping, arm weakness, speech difficulties, and T is time to go to hospital lah. Call 995 lah. Okay, so that's our second question for y'all lah. How to recognize a stroke? Okay, so how to prevent stroke? Anybody? See whether you all pay attention or not.
Y'all can unmute or y'all can type in chat if you're shy.
Do exercise, eat more vegetables.
Very good, very good. So not only eat vegetables, your muscle, right, need protein, so you need to eat protein also. Okay.
Hi, may I ask you one question?
Yes, Christina.
Normally, if a person has a stroke, average how long the person can live on? How many years or how long?
Actually depends on the body health. the body, your health, see whether do you have other chronic disease. Then after that, also see whether is there other complications. So actually, if you are following, adapt what I shared just now, like take a medication regularly, lifestyle, and actually do regular screening, actually you can lead so-called like a normal lifestyle like we are also. Okay, it's then yeah, just that your movement and so all this will be slower lah. Yeah, there's no any how many years that you can live if you have stroke lah. Yeah.
Oh,
I
okay.
hope I answered your question.
Yes,
Yeah.
thank you very much.
Thank you.
Hi, I'm Sister Irene. Can I add on to
Yes,
this
Irene.
one? Yeah, so it also depends on the site of the stroke and also the severity lah. So if it's a mild stroke, it's likely that the person may recover. And moderate stroke with rehabilitation, the person also may have good life after that, good recovery if they have rehabilitation. And also depends on the controlling of the risk factors lah. If let's say he has high blood pressure, diabetes and all that, if it's well managed and he continue to have look after his health with regular exercise, good healthy habits, he may be able to, I mean, the stroke person may still have a good quality of life after that and may live a, I mean, there is no say that how long he will live lah. Some people may live very long still. But if let's say the severity of the stroke is like severe and a person he is bedbound on tube feeding, then and also other things lah, because a person lying in bed, they can easily get infection, chest infection, urine infection, all those things. So sometimes this type of person may likely succumb to this type of infection and his may live shorter lah, I would say. Okay, and also if let's say the stroke affects the brainstem, which is actually the part that controls more the swallowing, the the breathing, all those things. So that will also reduce the likelihood of full recovery, more likelihood of bedbound. So that will also reduce his longevity, I would say. Yeah. So it depends on the severity, the site of the stroke, how much, disability after that, the kind of thing lah. Yeah, a lot of factors. But we also feel that always with rehabilitation, the chance of survival and recovery is better lah than without rehabilitation. Okay, thank you.
Yeah, as though need a lot of support now, especially the psychological support for the patient.
Yes, you are right. Very important to have a psychological support. That's why we have stroke support group as well. So a person who has stroke, we would like to also recommend that the patient and the caregiver, are encouraged by other stroke survivors and caregivers. Yeah.
Okay.
So
Thank God, you do a good job.
Yeah, it's okay. The Singapore National Stroke Association. Yeah, you can actually go into their website. Okay, there's a Singapore National Stroke Association. They are Singapore's association to help also to support those with stroke. And each hospital have their own support group as well.
Oh.
Yeah. Thank you.
Thank you for your answer. Thank you.
All right.
Any other questions?
Thank you for joining us. If there's no other question, then we will see you next week for the Mandarin one. I'm sorry, I just realized that my internet is actually very, very weak. So during my presentation, it's actually very muffled. I apologize for that. Thank you, everybody. Hope you bring some tips and some learn some information, useful information.
Yes, I like the fast, fast. Sorry, fast. FAST.
Yeah, fast. So time is brain.
Yeah,
Time is brain. So you find that the person with weakness, slurring of speech, or drooping, and then the arm, is fall down. It's a new disability, or new weakness. Then immediately call 995 ambulance. Okay.
Is C stand for communication?
What is that?
C.
C.
S speech.
Oh, speech. Okay. Yes. I don't know why the word FACT. Okay, thank you.
Okay, fast is face, arm, speech, and time.
Okay. Thank you.
So look at the face, drooping face. Arm, raise your arm. If the arm drop, then the speech. Tell me your name. If you say for example, like very slurred, or cannot speak properly, then time is brain. So immediately call ambulance 995 if this is a new thing for the person. Okay.
Okay. Thank you very much. Thank you.
Thank you also.
Thank you for the health talk. Thank you.
We thank the speakers.
Thank you for joining us. See you all next week for the Mandarin session.
Thank you so much. Very, very informative.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye.